Your kidneys can lose up to 60% of their function before a single standard blood test shows anything wrong. By the time most seniors are diagnosed with kidney disease, significant and often irreversible damage has already occurred. But here is what almost nobody knows. Your body starts sending warning signs months, sometimes years, before that diagnosis. And several of the clearest signs appear on a part of your body you look at every single day: your hands. I am Dr. James, and today I am going to show you 5 early warning signs of declining kidney function, signs most seniors completely dismiss as normal aging. Stay until number 1, because it is something I want you to check on your own hands the moment this video ends. Everything I share today is based on research published in the American Journal of Kidney Diseases, the National Kidney Foundation, and the Journal of the American Society of Nephrology. These are documented clinical signs that nephrologists are trained to look for and that primary care visits often move too quickly to catch. Before we begin, tell me in the comments, do you have a family history of kidney disease, diabetes, or high blood pressure? These are the 3 biggest risk factors for kidney problems, and your answer tells me exactly what to cover in future videos. Sign number 5. Number 5 is swelling in the hands and fingers, particularly swelling that makes rings feel tight or that leaves a visible indentation when you press on the back of your hand. Healthy kidneys filter excess fluid and sodium out of your bloodstream continuously throughout the day. When kidney function begins to decline, that filtering process slows down, and fluid starts to accumulate in the body's tissues. Because the hands have a large surface area of soft tissue and many small blood vessels close to the skin, they are often one of the very first places this fluid retention becomes visible. Many seniors notice this first thing in the morning: fingers feeling puffy, a wedding ring that suddenly will not slide off as easily as it used to, or hands that look slightly swollen in photos compared to a few months earlier. A study published in the American Journal of Kidney Diseases found that peripheral swelling, including in the hands, was present in 34% of patients in the early stages of chronic kidney disease, well before standard blood work showed significant abnormalities. Here is a simple test you can do tonight. Press your thumb firmly into the back of your other hand for about 10 seconds and release it. If an indentation remains visible for several seconds afterward, that is called pitting edema, and it is worth mentioning to your doctor at your next visit. Sign number 4. Number 4 is changes in the skin on your hands, specifically a pale, yellowish, or grayish tint, along with skin that feels unusually dry, itchy, or has developed a slightly waxy texture. Your kidneys play a critical role in removing waste products and toxins from your bloodstream. When kidney function declines, these waste products, particularly one called urea, begin to build up in the blood. This buildup can affect skin color, giving it a pale or sallow appearance, and it can also trigger intense, persistent itching that does not respond to regular moisturizers. Many seniors mistake this for simply having dry, aging skin and reach for lotion without realizing the underlying cause may be internal. The hands, because the skin there is thinner and the changes are easier to notice against the nails and knuckles, are often where this becomes apparent first. Research published by the National Kidney Foundation found that nearly 40% of patients with moderate kidney disease reported persistent itching, and that the symptom frequently appeared before patients were aware they had any kidney problem at all. If your hands have developed an unusual color, persistent dryness, or itching that lotion does not resolve, this is worth raising specifically with your doctor and asking for a basic kidney function blood test. Sign number 3. Number 3 is frequent muscle cramps in the hands and fingers, particularly cramps that occur at night or that happen without any obvious physical exertion. Healthy kidneys carefully regulate the balance of electrolytes in your blood, minerals like potassium, calcium, and phosphorus that are essential for proper muscle and nerve function. When kidney function declines, this delicate balance is disrupted. Electrolyte imbalances are one of the most common and earliest triggers of muscle cramping, and the small, frequently used muscles in the hands and fingers are often affected before larger muscle groups. Seniors often describe sudden cramping in their fingers while typing, knitting, gardening, or even just resting. Unlike a typical muscle cramp from dehydration or overuse, kidney-related cramping tends to recur frequently over weeks, often worsens at night, and does not consistently improve with stretching or hydration the way ordinary cramps usually do. A study in the Journal of the American Society of Nephrology found that muscle cramping was reported in 50% of patients with declining kidney function, making it one of the most common and most frequently overlooked early warning signs. If you are experiencing new, recurring cramps in your hands or fingers that do not have an obvious cause, track how often they occur and bring that pattern to your doctor's attention. If you are learning something new right now, hit that like button. It genuinely helps this information reach more seniors who need it. We have 2 more signs to go, and number 1 is the one I most want you to remember tonight. Sign number 2. Number 2 is changes in the appearance of your fingernails, specifically a condition where the upper half of the nail appears white or pale, and the lower half near the nail bed appears pink, brown, or reddish. This is known in medical literature as half-and-half nails. This distinctive pattern occurs because declining kidney function affects the small blood vessels beneath the nail bed and alters levels of a hormone called melanin-stimulating hormone, which influences nail pigmentation. The result is this very specific two-toned banding pattern that is rarely seen for any other reason. A study published in the Indian Journal of Nephrology examined this nail pattern specifically and found it present in approximately 40% of patients with significant chronic kidney disease, making it one of the more specific, though less commonly known, physical indicators available. Beyond this specific pattern, kidney decline can also cause nails to become unusually brittle, develop ridges, or show a condition where the nail appears to have a white band near the tip, with the rest of the nail unusually pale. Tonight, take a close look at your fingernails in good lighting. If you notice this two-toned half-and-half pattern, or nails that have become noticeably more brittle or pale over recent months, mention this specifically to your doctor. Sign number 1. Number 1 is the combination I most want you to pay attention to. Persistent, unexplained fatigue that occurs alongside hands that feel unusually cold, even in a warm room or while wearing gloves. This combination occurs because declining kidney function leads to reduced production of a hormone called erythropoietin, which signals your bone marrow to produce red blood cells. As red blood cell production drops, a condition called anemia develops. Anemia reduces the amount of oxygen being carried throughout your body, and the hands and fingers, being farthest from the heart, are often where reduced circulation and reduced oxygen delivery become noticeable first, as a persistent coldness that does not resolve no matter how warm the room is. When this anemia-related coldness combines with deep, unexplained fatigue, it creates a specific pattern that nephrologists are trained to recognize immediately, but that is almost always missed in a standard primary care appointment focused on other concerns. Research published in Kidney International found that anemia was present in over 50% of patients by the time they reached moderate-stage kidney disease, and that fatigue combined with cold extremities was among the earliest combined symptoms reported, often appearing months before any other sign. If you are experiencing deep fatigue that does not improve with rest, combined with hands that feel persistently cold, this combination deserves a direct conversation with your doctor. Ask specifically for a basic metabolic panel and a kidney function test. These are simple, inexpensive blood tests that can catch this early. Tonight, take 2 minutes. Look at your hands. Check for swelling using the press test I showed you. Check your nail color. Notice if your hands feel cold. And think honestly about whether you have had unusual fatigue or muscle cramps recently. If any of these signs sound familiar, do not wait for your next scheduled appointment. Call your doctor this week and specifically request a kidney function panel. It is a simple blood test that could catch a problem years before it becomes serious. And if you found this helpful, share it with someone in your life who is over 60 or who has diabetes or high blood pressure. They are the ones at highest risk, and they may not know what to look for. I am Dr. James. Stay sharp. I will see you in the next one.